Hi, my name is Dr. Shanteria Dixon, Assistant Medical Director of Adult Emergency Services at St. Mary's Medical Center. I am an emergency medicine physician, and my role in the hospital is to stabilize and resuscitate both critically ill patients and also patients with minor and moderate medical conditions. So I was actually born in Peoria, Illinois, but we moved to West Palm Beach, Florida, I believe when I was about 3 months old. I went to Seminole Trails Elementary School, Bear Lakes Middle for the first year, followed by Roosevelt Middle School. I did my first year of high school at Lake Worth in our allied health professions before moving over to Palm Beach Gardens Medical Center and their pre-med magnet. I then went on to attend undergraduate education at University of Florida, go Gators, followed by my Master's of Public Health and Health Services Management at Emory University in Atlanta, Georgia. I studied my tail off. I took a Princeton Review course, studied very hard, and was able to get a full scholarship to the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University in Cleveland, Ohio. I worked there for 11 years. My mother became ill, so I moved back to West Palm Beach, and here I am back in my hometown city. I was inspired to become a doctor because when I was 13 years old, I got hit by a drunk driver while walking across Palm Beach Lakes Boulevard. I ended up here at St. Mary's Medical Center, and Dr. Richard Weiner, who was an emergency orthopedic trauma surgeon, did an amazing job operating on both my legs and my pelvis for over 8 hours. He saved my life, and he also gave me the ability to walk again as a normal human being. I started shadowing him in his office and even in the operating room, and he became a lifelong mentor to me. Dr. Robert Borrego, who's also our current trauma chief, was also an amazing mentor. I shadowed him in the operating room as well as the emergency departments from high school and even throughout college. And even today, these two men who have been cornerstones in my career and my life are still very close friends. So these experiences really molded me to solidify my desire to become a doctor. I saw how much they genuinely loved helping their patients. They were kind, they were patient, they were intelligent, and everyone respected them. They were amazing pillars in the hospital and also the community, and deep in my heart, I wanted to be just like them. A typical day for me is a little bit atypical. I work anywhere from 10 hours to 12-hour shifts, and those shifts can start at either 6 a.m. in the morning, at 12 p.m. noon, or even 8 p.m. at night. So depending on the type of shifts and the time of day, they can be a very busy shift with very critically ill, sick, and dying patients, or they can be predominantly more minor or moderate cases. The most rewarding part of my job is the critical thinking skills that I get to use every single shift and every single patient. It is my responsibility to think about all of the possible diseases and conditions, whether they're life-threatening or not, this patient may have, and how I can fix them and make them feel better. And I think the most rewarding part about that is that I get to actually impact their care. I get to help them on that day, and patients remember that. And I think one of the biggest compliments I've been made by a patient or family is when they ask if I can be their primary care doctor and if I have my own office and if I'm accepting new patients. And I have to politely decline and tell them I do not have a private office, but I am extremely flattered that during that short period of time I was able to build a trusting rapport, and they trusted my knowledge and they appreciated my compassion, and that's probably the most rewarding part of my job. Medicine, and specifically emergency medicine in particular, is very stressful. It takes a lot of hard work, a lot of time, a lot of sacrifice, and establishing a good work-life balance is beyond critical. I can't be a good doctor if I'm not a well-rounded and centered person, and if I haven't done things to make me happy. So what I personally do is I love spending time with my family. My home-based family is my wonderful mother and my husband and partner of 17 years, and our fur baby named Quinn, who thinks she's human, even though she's a canine. I love spending time with them. No matter how hard work is or how bad of a day it is, I go home, they're there, they're stable, and that's what grounds me. My mother also had 8 kids, and I'm the youngest of those 8 kids, so when I have an off day, I love going to the beach, we go to the parks, we have family pool gatherings, and everyone's different, but that's what makes me happy, and that's what brings me back to my home base, is spending time with my family and my friends. My advice for any students considering a career in medicine or science is to make sure you're doing it for the right reason. If your heart is to help people, to make a difference in our community, then go for it. If this is the only thing you can imagine doing with your life and this is your purpose, then you should definitely go for it. It's a lot of work and a lot of time, at least 11 to 17 years depending on your specialty, and you'll miss a lot. I missed a lot of parties, I missed weddings, funerals, a lot of milestones and specific events that I won't get back. But when I take care of patients and they look at me and they say thank you and they appreciate me being their doctor, that's rewarding, and it makes it all worth it. And remember, don't let the cost of this field deter you from pursuing this as a career option. I was the youngest of 8 children in my mother's family, and she was a single mother who worked 3 to 4 jobs at a time. I personally worked at least 3 jobs during high school to help pay the electricity bill and the groceries, and I still made it. There are full scholarships, there are partial scholarships, there are grants, there are loans. There are a lot of different options, especially if you are a first-generation college student like myself, and especially if you have mentors who believe in you. Similarly, the T. Leroy Jefferson Medical Society offers great mentorship to students like you who are wanting to become doctors and scientists. We are here and available to help guide you throughout the process, to help hook you up with some of these scholarships and different financial options that are available. Don't let this be a deterrent for you becoming a doctor.